Good morning, everyone, and happy International Infection Control Week. Sterilization play a key role in keeping patients safe from infection and shows how the healthcare facility care about the quality and safety. Welcome to our workshop titled Sterilization Assurance in Healthcare Settings, Meet the Expert. Today, we are privileged to have with us a high respected expert in the field, Ms. Benek Shefelek, who brings over 30 years of experience in healthcare industry, specializing in sterilization assurance and device reprocessing. Ms. Benek Shefelek currently serves as a medical liaison, Europe, Middle East, and Africa sterilization assurance lead at Soliventum Medical Surgical Division. Previously, she worked with the 3M Medical Solutions as a medical science liaison, where she was responsible for device reprocessing. With a background in electrical engineering, specializing in biomedical engineering, she has built a career leads initiative that bring a technology and patient safety. Please join me in welcoming our expert, Ms. Benek Shefelek. Ms. Benek, floor is yours.
Thank you very much. And I wish all a happy infection control week, and I'm very happy to be with you here. Our objectives today will be to understand the challenging environment of the sterile service department, comprehend the necessity of sterilization monitoring tools, review the standards and guidelines related to sterilization, understand biological and chemical indicator technologies, and also today we are going to discuss two new technologies with you. First is a digital solution in equipment monitoring, which is an electronic Bowie-Dick system, and the second one will be the load control with challenge packs. I would like to start by saying every patient deserves the safe instrument, because every patient undergoing a medical procedure has a basic expectation. The environment and the instruments should be clean and safe. And safe surgery starts in the Central Sterile Services Department. Patient safety is the main goal of every sterilization department, and it is achieved by keeping patients and employees safe by reducing the risk of cross-contamination created by the instruments. And safe instruments can only be provided by monitoring every step of the sterilization process. We are telling about a challenging journey. I'm visiting central sterile units for many years across Europe, Middle East, and Africa, and I really witnessed how challenging environment you are at. So knowing about this, I can understand the expectation in this complex environment. Basing on my experience I have listed here, I'm sure that you will add more. So the patient and staff should be safe. CSSD is in charge of effective cleaning, decontamination, and sterilization process. Fast and timely delivery is expected. The trained staff to follow the quality assurance programs. You have to be always open and ready to use the new technologies. Keep up with changes in the organization. Utilize the standards and guidelines for best practices and good communication with OR and other stakeholders. So these expectations for sure bring the challenges together. So the challenges will be more or less the same, but if we list them like that, we are facing a challenging environment with complex instruments, because today technologies, they require minimally invasive surgeries. So the instruments are becoming longer and narrower, which means that it is really hard to clean. So if we cannot clean, we cannot sterilize. So this is the challenging point. And there is the time pressure for quick load release. So every surgery needs the equipment very quick. There is the workload of the staff and high turnover of the workforce. And there are the challenges to meet the changing demands of the facility. This can be due to organization itself, the management, the instrumentation, the types of surgery, the surgeons, so really demanding. Staff education We know it's very important, but in that busy environment, again, it is really challenging to have time to update with the new technologies and to raise the awareness. Communication with other departments. Departments should understand each other very well, especially OR and the sterilization unit. So they need to understand the responsibilities and they need to understand the expectation from each other. The implementation of quality management systems, in fact, it's a multidisciplinary approach. So CSSD is not the only one that should run it. It should be the infection control committees, the management, the OR. So it should be a really full focus. The loaner sets are always a problem, I know, because all the trainings I attend, the congresses, these loaner sets are really having the biggest issue. So they are sometimes coming clean. You have to sterilize them or you have to start the process from the beginning. So you have to make sure that these sets are really ready to use on the patient. Equipment maintenance, calibration, and new technologies. For sure, sterilizers, cleaners, washer disinfectors, these are our daily life challenges. So we have to keep the updates with them, keep them in good condition. Following standard updates to choose the right products and to perform the best practices. And of course, in general, keeping up with the technology. So, in a nutshell, we are really living in a very challenging environment and very busy environment. Our aim today is to discuss about how to reduce the undetected sterilization failures. And we have the solutions of equipment control, load control, internal pack control, really, which can help the CSSDs to reduce these failures. And when we look at the failure modes, in fact, we have already discussed the challenges. So we know about the human factors because we are operating the devices inside. The units are being prepared, cleaned, inspected, and sterilized by the staff. And equipment is an important fact because we have to keep up with the technology, with the sterilizers, and also all the instruments that we're taking care of. And load is always the important point because the configuration, the material and cycle compatibility is also reflecting to sterilization success. There are steam sterilization failures. Steam sterilization is the one that we are using the most. For that reason, we have to know how it works for sure, the right cycles and everything. But at the same time, we have to acknowledge that the load we put inside is of great value and importance because when we put the load inside, we know that steam works like this. So first, the vacuum, all the air is out of the chamber and then we expect saturated steam inside every load. So there should be some really good space in between the load. So the density, the materials, the right cycle, they have importance in steam sterilization success. For hydrogen peroxide, it's another technology. This is low temperature we are using most during these days. So hydrogen peroxide is not as robust as steam because it has not the real ability to reach really the narrow lumens and long lumens. Therefore, load configuration, the materials, and also the dryness, the density, the weight, these are all important for hydrogen peroxide sterilization success. The routine monitoring of the cycles. So why do we monitor? Because if we monitor the cycles, this will provide the healthcare facilities successful sterilization processes. And it will be a tool for sterilization control. As we discussed, it will significantly reduce the risk of undetected failures. For sure, it will improve the patient safety and at the same time, it will demonstrate compliance with standards and guidelines. When we focus on steam monitoring, we know that there are 4 levels to ensure sterilization assurance. First of all, we need to again acknowledge that every cycle is a distinct event. So even if it is the same sterilizer, the cycles are quite different from each other. So therefore, we have to make sure that we are really performing these 4 steps to ensure sterilization quality and saturated steam. Equipment monitoring, we are familiar with everyday Bowie-Dick test, and load monitoring is done by biological indicators, and the best practice is every load monitoring. Every pack, we place an internal indicator to see if sterilization conditions are inside at each pack. And outside every pack, we have the external pack monitoring, and these are usually tapes, exposure tapes or labels. I am also active in standard committees, which is TC 198. This is the Sterilization Mirror Committee. And ISO is working very hard on updating the standards. And one of them, which has been published recently, 2024, is the ISO 17665. This is important for CSSDs because it is telling us all about the moist heat, which we use the most inside the CSSD. And this is telling about the requirements for the development, validation, and routine control of sterilization process for medical devices. So this is steam sterilization standard. In this standard, there's an important section which is called routine monitoring and control. And here it states that routine monitoring and control shall be performed on each operating cycle in order to demonstrate that the process variables are attained. So what are the process variables for moist heat or steam? So we have three. This is time, temperature, and saturated steam. So saturated steam is the most important variable. And in the next slides also, I will be talking about these three variables. We understand the importance of steam quality for successful sterilization. It is critical because if the steam is not saturated, then there will be less condensation, so there will be less energy release to kill the microorganisms. So this sterilization will not be successful. And we are talking about non-condensable gases in the steam. These gases will prevent the uniform condensation, the effective condensation, and it will affect the quality of sterilization. So what are these gases? In fact, these are what is present in the air. So carbon dioxide, nitrogen, which cannot condensate under steam sterilization. So there are various points where these come from. So they can come from the vacuum pump, because if the vacuum pump does not work well, it means that there will be air pockets inside the chamber. And also inadequate air removal will have these non-condensable gases and prevent the effective condensation. There can be some leaks due to the valves, the gaskets, because sterilizer is working all day and these pieces are working under pressure and higher heat. So these can be also another reason for non-condensable gases. Feeding water, as we all know, always very important, and also the lines, the steam lines and valves. These all can create these non-condensable gases, which we should prevent. Equipment monitoring, as I discussed in the previous slide, this is the first level, and we are aware that it should be done every day. And today we are using some test packs ready to use. There are stacks of paper, and there is a ready-to-use test pack. But inside, we know that there's a chemical indicator which changes from one color to another. So this does not give us an objective result. And knowing about this, we have been working on a newer technology, which is all about digital solution. This is a digital solution, but it fulfills all the requirements like a test pack, because there's a certain standard, ISO 11140-4, so and 5. These are all related to Bowie-Dick test ready-to-use packs. So the digital offer now we are bringing you is the new electronic Bowie-Dick test, but again, fulfilling the same requirements with a traditional test pack, because the same tests are performed. When we're talking about Bowie-Dick, we're telling about numbers, hundreds of lots being tested under several conditions which are stated in the standard. So there is a pass value, there are fail values due to leak conditions or air injection conditions. So this test all fulfill these requirements. This test is composed of three items. So one of them, the main part, is the Bowie-Dick test card. The second you see on the right hand is the card holder. This is making the ATEST card easier to place inside the sterilizer. And we have the reader. So if you are using some biologic indicators, fast respond ones, you have to be using the same type of incubator. So now this is designed for this ATEST test card. So what will be the benefits? So first of all, as I mentioned, the color change in the traditional pack can create some errors due to human interpretation. With this design and with this technology, you will have a significant result about a pass or fail. And when you place the card after exposure in a Bowie-Dick test cycle, you will see the result in less than 5 seconds. It fulfills all the requirements of the FDA. FDA has created a new subject for this kind of testing, and also ISO requirements as a Bowie-Dick test. It is full digital, so there is no need to interpretation and no need to keep the test sheets or file them or scan them, so it will save time. And also it has the opportunity to connect this device with the tracking systems in the hospitals. How does it work? First, I have to tell about the design, because we are used to have the test packs which we place inside the sterilizer, and we expect the steam penetrate through these paper stacks. But now, as you can see here, the design consists of a lumen challenge, a lumen-based challenge, which is making things very harder for the steam. So we expect when the vacuum pump starts, we expect the vacuum to take the air out from the chamber, also from this lumen. And then when steam is injected, we expect the steam going to this tunnel and then reach to the electrode pads. And how it works: when there is saturated steam, this card undergoes a change in electric resistance. So after the completion of the cycle, this card is placed in the autoreader, and this electrical resistance is measured by this autoreader. So when we have a pass, it means that there is adequate air removal and steam penetration, and just the opposite, when there is no sufficient air removal or steam penetration, this is indicated by a fail result. We put this device or the test card inside the card holder, and we exactly place in the same way that we place a test pack. So it is over the drain. And when we take it out, you will see that there is a hole, and around this there is a darker color, which means that this is an exposure indicator, which means that this test card has been exposed. But it doesn't tell you anything about the pass or fail. The thing you have to do is to put it inside the autoreader, and within 5 seconds, you will see either a tick, which means that a pass, or a fail, which means that there is no sufficient vacuum or steam penetration. This has also a web-based software, which is called ATEST Connect. What you have to do is just to type in and get in the software, register your device, then download the software and start using it. So all the memory will capture all the results. Also, it is a cloud-based, so all your results will be kept in cloud. When you move to load monitoring, we know that load monitoring is done by a biological indicator, because all the guidelines, they reference to this type of biological indicator, because it is the only actual indicator that can show the inactivation of microbial spores. And we know that there are several available for steam, for hydrogen peroxide, and they have dedicated auto readers, which you can have the results automatically. Biological indicator design should be different in fast response indicators because there are several indicators which can result in longer times. Like it started with 48 hours, it came to 3 hours, and then 1 hour, and now we are talking about minutes. So therefore, this technology should reflect the design of the indicator. So as you see in the bottom, there is a narrower part of the sleeve, and also there is a non-woven material over it. So this is a perfect place for the microorganisms to grow if the sterilization is not successful. So there should be the also design that is reflecting the technology. For hydroperoxide, the same technology is there, and also you can use again the auto readers and another type which is called mini auto reader to have your results in a shorter time. And also while choosing the indicator, yes, indicator technology, certification, and the performance is very important, but at the same time, we have to consider about the technology of the auto reader, because auto reader also should prevent the human error. Whenever you are not successful in crushing the media, if the media cannot see the spores, so this auto reader should also inform you about this, should warn you, because if you don't crush and if the media doesn't see the spore, even if the sterilization is not successful, you cannot have the right result. So when talking about biological indicators, we always consider auto readers because they are a full system and they are validated with each other. There is an important point about choosing an indicator. There are several standards, but also the indicator you are choosing should be able to give you some certification, provide you some certification, really showing that they are complying with the standards. For STEAM biological indicators, there are three important standards. The first is the ISO 11138-1. So this is the general approach for the biological indicators. So this is the general concept. When we tell about -3, this is telling more about STEAM biological indicators. So the spore, the number of population. But these will not be enough because we are talking about a rapid system, super rapid systems. So there is a standard which is published in 2021. This is ISO 11138-8. This is the method for validation of a reduced incubation time for a biological indicator. This is important because if you are working with a super rapid system, so you have to be able to see the compliance to this standard. And this standard also should be documented by a global independent notified body, and you have to be sure about the performance of this item. And reduce incubation time, in fact, this requirement is coming from the FDA protocol. So this ISO standard is also taking the base from this FDA requirement. We're always discussing about the frequency of monitoring because we always say the best practice is every load monitoring. So what every load monitoring can provide to the patient and the staff? First of all, the highest standard. So we will have the highest standard for all patients and highest level of quality control, and it will be a best practice to be in your quality assurance programs. There will be less room for errors at each cycle, and of course, we will minimize the risks associated with the undetected sterilization failures, and you will have faster results, and this will enable you to respond a faster corrective action. SD79 is a very important book or a very important reference globally, although it's AMI. We're also utilizing it in Europe, Middle East, and Africa. So this is telling about all the details of steam sterilization, and there is a very important section which is 1375, which is what actions to be taken when the sterilization is a failure. And whenever you have a BI positive, here it clearly states that all loads back to the last negative BI should be recalled. So if you are performing a best practice of every load monitoring, for you, it will be the last cycle. So every load monitoring is also having a great importance here when it comes to sterilization process failures. Internal pack monitoring. The best practice again is putting one internal pack indicator at each pack to see if, for instance, for steam, time, temperature, and the most important part is saturated steam is inside every pack. And this is an example wherein WHO surgical safety checklist is also telling nursing team to check the internal pack indicators. So has sterility been confirmed? Of course, alone chemical indicators will not tell about sterility because we need the also response from the biological indicator. As I told in the beginning, all these monitoring levels, they support each other. So if the chemical indicator is a pass, also we have to get confirmation from the biological indicator. I would like to tell a bit detail about the standard because ISO standard is a good reference for us to choose the right product we need. So what type of indicator shall I use? ISO 11140-1 is stating types. It's not saying classes of indicators, it's saying types because each indicator has a different performance, has a different mission. So this is a list. I have taken the types which we use as internal pack indicators. So type 4, type 5, and type 6, and I will try to explain the differences between those. When we read about type 5, it is designed as a multi-critical indicator, but the definition is important. It says it is designed to react to or more of the critical process variables. For steam, we have three variables: time, temperature, and saturated steam. For hydrogen peroxide, again, we have three: time, temperature, and this time hydrogen peroxide concentration. So if we are talking about three variables and if we want them to be achieved inside each pack, so it will be the right decision, in fact, to choose an indicator which will react to all critical variables. For that reason, type 4 will be providing us limited information. When we move to type 5, it has a different explanation here. It says it is reacting to all critical variables, but the stated values should be equivalent or exceed the performance of a biological indicator. So why it tells about this? It doesn't mean that a type 5 will replace a biological indicator, but it means that the stated values, I mean the pass-fail threshold values of a type 5 is tested under as challenging conditions as a biological indicator. Biological indicators, according to standards, are tested in three different time-temperature correlations: 121, 134, and 128. So they are taking the lethality curve around this time temperature correlation. And in the same way, type 5 have three stated values and they are tested under these challenging conditions. So therefore, type 5 will give you more information about the quality of steam inside every pack. In recent years, we are seeing some type 6 emulating indicators, but these are not equal to type 5. They may be again defined as reacting to all critical variables, but these are cycle specific. They have only one stated values. So you see a time temperature correlation printed on the type 6, but it tells that it changes color with steam presence under this time and temperature. So therefore, while selecting a type, we have to be taking care of the definition and which we will need. Because you may think that type 6 is also a multi-critical with three variables confirming, but still this is for specified cycles. So when a type 6 changes color, it means that at this pack, steam has reached that temperature for that time. But when we talk about type 5, we are meaning to be used in every cycle starting from 121 to 134, but it will sense the steam quality inside every pack, and it will either change color or most favorable. Also, there will be a accept window which you can see the past results. This is an example of a type 5 integrated indicator from our solutions. And again, it can be used in every cycle, not for a specific cycle. And it will be easier to tell about pass or fail results because also, as you can see in the chart, there is a threshold between reject and accept. So anything beyond accept window will be accepted because every pack is different and their way of penetration of steam will be different. So it is not necessary that you see all the window black. So any movement beyond the accept window will be accepted. I also try to compare the types, as I mentioned before. So type 5 and type 4, when we compare these two, we said that type 5 responds to all variables, but type 4, we say two or more. So we may not know which two are attained or achieved. Type 5, again, three stated values with under challenging conditions, but type 4 cannot specify these three stated values. We told that type 5 CIs, they provide a response with relationship to a BI, but in type 4, we don't have this. And usually they are moving front and it is easier to see and interpret. But here it's color change. So while changing color, you cannot really understand what is the reason for it. If it is two process variables, for instance, so what is it confirming? So also this can be helpful while choosing the type 5 or type 4 product. This chart also shows us that there is difference between an integrated indicator type 5 and type 6 emulating indicator testing because we always tell about these three stated values correlating with a BI, but here emulating indicator doesn't have a correlation with a BI and only tested in one time and temperature relation. Another comparison stating about the stated values for type 5, three time and temperature relationships, but type 6 has one. Type 5, that doesn't have any elimination or limitation. It can be used across multiple cycles, but for each cycle, you need a different type 6, confirming this time and temperature. When you look at AMST 79, it is really clearly stating that for early release of implant loads, in case of emergency, type 5 is needed, even it is needed in a PCD together with a BI. But for type 6, we don't have such requirement. Also, we have to pay attention to a chemical indicator inside a hydrogen peroxide pack, because in hydrogen peroxide, we said it is not as robust as steam sterilization. We have no mechanism for an equipment monitoring. So it's really important to see the BI result, and also at every pack, we need the chemical indicator. And here there's a new approach with a type 4 hydrogen peroxide chemical indicator. So this is the also FDA cleared type of indicator, and it has a different design, maybe the ones are used commonly. You see that this is a kind that has a small opening at the side, so which makes hydrogen peroxide, it forms a pathway, and we are more challenging hydrogen peroxide here. So we expect hydrogen peroxide to enter inside this tunnel and then change the color. You see the cut and blue parts. So we expect all the color to change to pink. So this is a moving front technology. This is a type 4, but it is responding to three critical variables: time, temperature, and hydrogen peroxide concentration. I have visited some CSSDs around this product or this approach. And most of the times, I really witness that the ones that are used in the packs are mainly type 1. We know that type 1 are maybe some exposure tapes, but we see that there are some indicators, there are some strips which are really type 1. They are not working like a type 4. So maybe it's also valuable to have a look at the practices, and in also the hydrogen peroxide packs, a type 4 will be an ultimate solution for the users and for patient safety. When talking about load control, at the beginning, we said that we are going to introduce you some new technologies. So the first one is the super rapid hydrogen peroxide clear challenge pack. So we are familiar with process challenge devices, because also in the guidelines we are offered, or we are recommended to use process challenge devices which have a BI and a CI inside, and to challenge the sterilant and to have the best sterilizing conditions. So this system is called a clear challenge test pack. As you can see, it's transparent. It is having a biological indicator for hydrogen peroxide together with a type 4 indicator, again designed for hydrogen peroxide. So this is the first ever pre-assembled pack, because in usual practices, we know that a biological indicator together with a chemical indicator is placed in a Tyvek pouch, but this does not represent a challenge pack, because this is just a holder for a biological or chemical indicator. So here, with this design, there is no need for another time to pack the devices together, and it simulates a challenging environment, because this product has been tested across various sterilizers, cycles, models of the sterilizers. So here also clinical testings are done. So it is according to the most challenging location, most challenging situation. And in hydrogen peroxide sterilizers, fast cycles, they are mainly the risky cycles. So here, with this design, you are sure that you are really challenging the sterilant, and you are trying to resist for the most worst case scenario. And here again, as we are familiar with PCDs in steam sterilization, also this type of approach will give you the same level of safety as you are performing in steam sterilization. The biological indicator process challenge devices. So they were developed to assess the efficacy of the process. And a biological indicator is placed inside a PCD, a process challenge device. So it makes more difficult for sterilant to reach. And in fact, BI can be taught as representing the microorganisms on the medical devices, and while the process challenge device, the design itself, is representing the packaging effect. And a PCD is used both in routine monitoring or in qualification processes. And whenever there is the chemical indicator inside, also this chemical indicator will show if the variables are achieved inside the pack. And this also, as the PCD is representing the most challenging conditions, so you are sure that also whenever BI together with CI has the result of negative BI and the past CI, you are sure that the sterilant is overcoming the challenging conditions. In this design, we are aware of the 1295, and this is dedicated for hydrogen peroxide sterilization, and it has the reduced time technology. Also, we have talked about the hydrogen peroxide trimetric indicator, which is type 4, and these are brought together inside the shell. And as you can see here, it has two channels. Here we expect after the cycle, when the air is out of the chamber, also the air inside the pack should be out through these channels. And we expect the hydrogen peroxide enter inside and reach to BI and CI. We talked about the technology of steam in the previous slides. Here, in the same technology applies for 1295, also the same design and same certification. And we talk about the same safety features for the autoreaders. And I told you that the prevention errors from the human also should be an important fact to choose the right autoreader. We have talked about the technical design of a type 4 indicator. Again, this should be certified as a real type 4 according to ISO 11140-4. When we look closer to the technical design, we expect the air out of these channels, inside the PI, also from the CI. And when the injection begins, the conditions are all there. We expect hydrogen peroxide to penetrate through these channels and reach the biological indicator and the chemical indicator. We have been using maybe the right practice because we cannot put biological indicators alone. We need a Tyvek pouch to place biological indicator together with a chemical indicator. But this is not a process challenge device. It is not tested accordingly. So it cannot give this lumen-based challenge. And therefore, when you put something like the right picture yourself, this is something only to hold the BI and CI together. But on the left side, you are working with a more challenging and tested, confirmed technology. We received the questions about where to place the biological indicators inside a chamber. Usually, we expect the sterilizer companies or the manufacturers to tell about the most challenging situation inside the sterilizer or most worst case scenario, worst point, let's say. Here, with this design, in fact, this design is providing the user the worst case scenario because the design itself has a challenge. But in general, when placement is asked, we can say that you have to place this PCD on the top rack towards the chamber door, which is tested to be the worst condition area. If you don't have any place to put this as on the left picture, then you can lean it against a pack, but always these two channels should be up. Transparency will provide the user to inspect the biological indicator and chemical indicator before and after process. You can also control the chemical indicator, this is type 1 process indicator, at the top of the biological indicator, and be sure that it's not exposed first, and then you put it into the sterilizer, and after the process, you see that it has changed, which means that it has been exposed. But then you have to take this PI out, put it in the autoreader, and also inspect the type 4 indicator. We have another solution for steam. In fact, steam test packs are being used as also recommended by Amy, but they were again stacks of paper representing a towel pack. But again, we have the same technology because 16 towel pack is always a reference for a PCD. So whenever you are talking about the PCD for steam, you have to make the testing, to see if it is really, again, having the same requirements with the 16 towel pack. This is another clear test pack, but this time you see that lumen-based challenge is much more different. And again, as we discussed before and after opening, you have the ability to see the indicators to inspect them inside. This challenge is posed by every instrument, everyday life. So this is the challenging part of the PCD. So again, we expect whenever we put it inside, we expect first with the vacuum, the air should be out of the chamber, out of the load, and at the same time out of this PCD. And with the quality steam injection, we expect the steam to reach through this channel and inside the also moving color technology type 5 indicator and also with the PCD containing biological indicator. Again, this is, of course, FDA cleared and always equivalent to AMI 16 towel pack. So these are the components we are familiar with. So 1492B is the 24-minute biological indicator. Also, this is the A-test type 5 indicator, the integrating indicator, which is called integrator. We are, in fact, familiar with the right picture, which is the traditional challenge pack. You see that there are some paper cards, and in previous design, the chemical and the biological indicator were embedded in this design, and it is wrapped. And you see that this is a pack type of approach, but now it's transparent. So again, when we talk about the weight of the discarded product and packaging, this is, the waste up to 82%, of course, by weight, when you compare it to the super rapid steam plus challenge bag. So we have improvement also in terms of weight of discarded products. Again, the compatibility with both devices, the auto readers. And here I would like to tell you about the testing, how we come up with this device. There is a clear, of course, reference about Amy towel packs. So what is done, in fact, that the same lot of BIs and CIs were placed in several 16 towel PCDs. And also they are compared with the same lot of 1492 PCD, the clear challenge pack PCD. So here, first, of course, there is the pass condition where we see that both Amy towel BIs and CIs have the same pass result with the PCD. The second was with a more fractional vacuum. So we expect, worse conditions. So we see that both the PCD BICIs and also the towel pack, which we place there, have the same positive BIs and fail CI results. Also, a clinical testing was done. And the second part was to show if this system, this PCD, is showing greater resistance than a standalone BIs. So when they made the test with a fractional vacuum, they see that the PCD is capturing the challenging results. So here then two claims were validated. So with this design, the resistance was equivalent to Amy 16 towel pack, and at the same time, it is demonstrating the greater resistance when you compare to the standalone BI. The technical design is now lumen-based challenge is a bit different. You see a more tortuous channel, but the idea is the same. We expect first in the vacuum phase that all the air is out, and when steam is inside, we expect the steam perform inside the load, inside the chamber, and also get into this channel, reach the biological indicator and the chemical indicator, and in past conditions, we expect that the biological indicator is negative and type 5 is a pass in the accept window. This unprocessed and processed vision can also tell you once again that with this approach, it will be better to see before and after the biological indicator label, the integrating indicator pass result, and then opening the pouch or the PCD and then putting the biological indicator inside the autoreader for the result. All right, so the placement again, another question always asked. We know that the most challenging part of a of a sterilizer is over the drain and mainly near the door. So here the approach is the same. So you can place this process challenge device with the foil side up or down, does not matter, in the most challenging area. So it is always like this in the picture, in the bottom shelf and over the drain. So of course, we don't expect to put anything on these PCDs. In general, as a summary, we can say that both designs, in fact, clear challenge packs both for steam and hydrogen peroxide, are designed, in a precise engineered way. And here in steam, we have the equivalence with 16 towel pack PCD, and also it's a greater resistance than the standalone indicators. And it is recommended to be used safely and effectively, both in routine monitoring and also in qualification testing of steam sterilizers. And thank you very much for your time. This is all I would like to tell you today, and I'm open for any questions, and I can also check the chat if the audience have any questions.
Thank you so much, Ms. Shifelik, for this insightful and comprehensive presentation.
I
As
think.
Ms. Shifelik mentioned that now the time of question, please feel free to raise your hand to open the mic for you or to
Mhm.
submit your question through the chat box. Any question, please? So since we are not seeing any question, thank you again. Thank you, Ms. Benik-Cheverik, for sharing your expertise and valuable insight on sterilization assurance in healthcare settings. Your contribution in helping improving patient safety and elevating sterilization practice across the region. And thank you to all participants for joining us today. We will hope you leave with practical knowledge and renewed motivation to enhance sterilization assurance in your own institution. Have a great day and happy International Infection Prevention Week.
Thank you so much. Thank you. Happy International Infection Control Week. Thank you so much. Thank you.